Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello, everybody. This is Luis from the Stem Cell Healing Institute podcast. I'm here with Dr. Sara Figueredo, and we have a very interesting topic today. But let me introduce the doctor. Doctor, how are you?
I'm very well, Luis. How are you?
I'm doing great. So, for you out there who are listening, we know a lot of people are listening because we see the numbers here. We appreciate that you like this podcast, and if you like it, please share it. You may know someone that needs this treatment, and we are here to help. So, in this case, we're gonna talk about the customized and comprehensive treatments that we do. It's not like one fits for all. It's not like that here. We do personalized treatments, and doctor is going to explain about that. Every patient is different, right, doctor?
That's right. You know, it's so important in the way that I practice medicine and regenerative therapies. It's really, really important to take into account that every patient is an individual. And we don't identify a patient by the disease condition that they may possess. It's really important that we address our patients this way, and that's what results. That's what gets us the best results. And we've been very, very blessed in having patients see change and positive change in every situation. So I attribute it to the fact that we not only have a state-of-the-art stem cell treatment, but the comprehensiveness and the individualized aspect of the treatment, which we we're very, very proud to offer.
Yeah, because I suppose with all your pharmaceutical experience that you have, dosages are very important, right?
Yes, Louise. I have had training in pharmaceutical compounding, and we compound here everything from the organic coffee suppositories that we administer for the total body, the total detox program, as well as we create our own injectables so that they're preservative free and fresh as we go along with patients, so they're not coming off of a shelf, preservative laden, as well as all of our formulas that we formulate for patients are specifically designed for that patient in terms of the types of combinations of herbs and minerals and so on and nutraceuticals, as well as the dosages. So we're really proud to be offering this type of a service that really makes a difference. In the end, it really makes a difference. We also specify the types and numbers of stem cells that we're going to be using, and very often we combine different types of stem cells for the best possible results for that patient and from, and as well as growth hormone dosages, as well as taking into account a patient's whole medical condition as a whole. For instance, if a patient comes in with erectile dysfunction, we will not only just hone in on that part of the anatomy and just, go to town with that part of the anatomy. It's about getting the whole history, figuring out, is there a psychological component? Component? Is there a hormonal component? Is there a physical component? We have to hit all of these target areas because it's not always just physical. There is very often a psychological or emotional factor at play. There is always, almost always, a hormonal factor at play. And we address all of these, again, individualizing the treatment as we see necessary to get the best possible results for the happiest patients.
Yeah, it's not always about intravenous injection. It's more about the whole picture, right, doctor?
Yes, that's right. That's right. And, because I started with erectile dysfunction, we'll just sort of continue on that vein. Um, And so, in terms of, with the erectile dysfunction, we will hone in on the root cause or causes of the problem. We will address each of those causes. Again, it's really important for us to get to the root cause of the problem. That is the way that I have always practiced medicine. And so we would most likely do an intravenous stem cell IV, where the stem cells can go everywhere the blood flows, plus possibly a local injection, plus possibly address any hormonal issues, as well as psychological and emotional.
And we also do oxygen therapies.
Yes, yes. Thank you for bringing that up. We also individualize those treatments in terms of the length of time per session, as well as the type, whether it's exercise with oxygen therapy or hyperbaric oxygen therapy. Very often there are people that are not candidates for exercise with oxygen therapy, for instance, which is the one that we tend to prefer to use because it's very comparable to hyperbaric. It's only 20 minutes on a stationary bike at a moderate pace, and patients are in and out of there much more quickly. However, there are patients that may not be candidates. If we have a patient that suffers from a paralysis, of course they can't ride a bike. In that case, we would use hyperbaric oxygen therapy, and vice versa. If we have a patient with a pacemaker, or is claustrophobic, or is a smoker that may have nodules in the lungs, these are all patients that are contraindicated in the use, or hyperbaric oxygen would be contraindicated in that situation. So, and they would be better candidates for exercise with oxygen therapy. So, yes, we even individualize the oxygen therapy as well.
We also do a total detox program.
Yes, that's right. Yes, and what we do with that, the way that we individualize that is, again, according to the patient's history. For instance, if a patient has had a history of, migraines or asthma, but they're not at the Stem Cell Healing Institute for that specific reason, we will combine the nutrients, the injectables in the total detox program to even address a migraine patient or a patient with migraines, or even address the issues of asthma that a patient may suffer from. And we can do this with the specific combinations of the injectables in the IV that we administer. So we're really proud to be offering this type of a service that we don't see happening at other clinics.
So, doctor, do we have any other complementary treatments at the Stem Cell Healing Institute?
Yes, thank you for asking, Louise. So, with along with the total detox program, the growth hormone therapy, the anti-aging compounding, and the compounding, the pharmaceutical compounding that we do for specific needs, whether it's hormones that we compound natural, bioidentical hormone replacement therapy for both men and women, um, or platelet lysate, which we always combine their growth factors from the patient's own blood, which we always combine with stem cell therapy, as well as the oxygen therapies and the yes, and mesotherapy as well, which is basically injections into the mesothelial layer of the skin, which can be for fat and cellulite reduction or rejuvenation with stem cells, as well as hair loss and hair replacement or hair stimulation of the scalp, as well as high dose vitamin C, high concentrations of vitamin C IVs for specific needs, whether it's immune or cancers and so on and so forth.
I suppose some of these therapies can work for after COVID treatments.
Yes, yes, that's actually another topic that I believe we've covered in the past, and we may need to do it again because we have so many inquiries for that. Yes, so with post-COVID sequela, or however the case may be, it could even be another virus or immune condition. We treat them very specifically with, depending again what the patient requires and the history of the patient. It could be a series of high dose vitamin C IVs. It could be possibly stem cells with the whole comprehensive treatment, combined with a specifically formulated injectables and formulations.
Yeah, for sure. And maybe the oxygen therapy could also help to. Yeah.
Absolutely, absolutely.
So this is like a tune-up that we need to do once in a while, right?
Yeah, yeah. I think that according to the way that we do things, a lifestyle is really, really important to be able to maintain the positive results of these types of treatments. It's really important that we keep in mind, what we're putting into our bodies, the stress in our daily lives. We're never going to avoid stress, but it's how we cope and how we deal with it and how we diminish it as much as possible, or diminish the detrimental effects of it. So all of these things are such a factor, a huge factor, that we have to remember to always keep in mind whether or not we do these treatments in order to have the best possible lifestyle and best possible quality of life.
Excellent. Doctor, I need to ask you, you want to add something else to this podcast?
No, I think we've covered a lot of ground. Um, I think that would be it, Louise, unless you have anything more to add.
No, I think we are all set here. In case you have any questions, please write to Dr. Sarah Figueredo. We're going to leave all the information by the end of this podcast. If you like it, please recommend your friend or your family member, and we'll be happy to answer any questions. Doctor, you have a great day.
Thank you, you too, Louise, and have an amazing afternoon.
Okay, you
Bye.
take care. Bye bye. If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.